I'm Laura, and I'm a graduate student clinician at the University of Wyoming. I wanted to share with you some information about the integrated behavioral approach to treating selective mutism.
I have a 5-year-old son. His name's Johnny. I was so excited for him to start school, but recently his teacher told me about some problems that he's been having. He won't start conversations with any of the teachers or respond to any of the questions that they ask him. He talks to me at home just fine, but he won't speak in school. He's a really smart kid. He points out the right answers when the teachers ask him to, but he just won't say it out loud. He was never really outgoing, but this has become a real issue since he started kindergarten. I'm just really concerned that he's not making any friends, and he really throws a lot of temper tantrums while getting ready for school.
This is what selective mutism may look like in a child, but it can look very different for different children. The difficulty speaking should persist for at least 1 month and not better explained by another disorder, such as speech or learning disorders. Also take cultural considerations into account when diagnosing for selective mutism. For children moving to a country with a new language, consider selective mutism if they have difficulty speaking, but they have adequate knowledge of the new language. It can be challenging to find a provider to diagnose and treat selective mutism. We recommend looking at the Selective Mutism Association's webpage for providers and tips for finding a provider. You could also look at the Anxiety and Depression Association of America's website or the Association for Behavioral and Cognitive Therapy's website. You can also visit effectivechildtherapy.org for more information on evidence-based treatments. Once you find a provider in your area, make sure to ask them questions to make sure the provider is the right fit for you and for your child. Here are some questions you can ask. Are they familiar with the integrated behavioral approach? Do they provide evidence-based treatments? What does the proposed treatment look like? Does it involve a talking ladder, exposures, transfer of control? What homework is assigned? We know these components are important to effectively treating selective mutism, so if your provider can describe these and say they are incorporated, that's great news. You'll also want to know who is involved with the treatment. It's important to get different people involved with the treatment, so ask if your provider is willing to work with these people. We think it's important to know about the evidence that supports how well a treatment will work. Selective mutism is a rare disorder, and it can also present differently in each individual child, making it difficult to study treatments. However, there have been 2 studies that show the integrated behavioral approach is an effective treatment. The studies have demonstrated about 75% improvement in speaking after the treatment, increases in the number of words spoken, decrease in severity ratings of selective mutism symptoms, decreases in social anxiety, and these improvements were maintained at a 3-month follow-up. Now let's discuss the treatment elements of the integrated behavioral approach to selective mutism. The integrated behavioral approach to treating selective mutism will typically involve 20 total sessions. Each session will last for 1 hour, and the treatment will be given over the course of 24 weeks. The child, parents, teachers, and anyone else involved in situations where the child has difficulty speaking can be involved in addition to the therapist. The more situations and the more people involved, the better. The therapist can help you develop a reward system for meeting goals. Goals can include any desired speaking behavior that the child finds difficult. Brainstorm all the rewards that you can think of to keep it interesting. Divide the rewards into small, medium, and large rewards. They should be given in proportion to the behavior performed. Rewards for the goal behaviors provides the child with positive reinforcement, which can increase a behavior by adding a good consequence. For example, giving a child a tub of Play-Doh for speaking makes them more likely to speak in the future because that behavior was rewarded. While using the reward systems to encourage your child to speak, you may need to discontinue the reward systems for other behaviors like household chores. Your therapist can help you and your child transition to using reward systems for speaking behaviors during this treatment. The child will learn to use a feelings chart during this treatment. The feelings chart can help the child identify how intense their emotions are in different situations. The child may experience different emotional intensity in different situations or with different people. The feelings chart identifies situations that can be targeted in exposures. The exposures should be gradual, starting with situations with a lower intensity of emotions and moving into situations that cause higher intensity. The feelings chart plays an important role in understanding the intensity of emotions before and after an exposure. The talking ladder is a way to identify situations where the child avoids speaking and helps organize these situations based on the intensity of emotions and avoidance. For example, the child may only occasionally avoid verbally greeting a cashier at a grocery store, but always avoids speaking to their teacher. The talking ladder will provide guidance on what situations to target with exposures. The exposures will start lower on the ladder and gradually work their way up to situations that cause the most intense emotions and are most commonly avoided. Exposures will occur in therapy sessions as well as outside therapy sessions. Exposures outside of the therapy setting is an important part of this treatment, and we will be talking about that again in just a minute. Let's take a quick detour to discuss how exposures work to change behaviors. Exposure is deliberately confronting a behavior or object that causes fear. It's very important to understand that exposure is not just forcing the child to speak. Exposures give the child an opportunity to learn that they can speak despite being fearful, experiencing the natural decrease in fear over time, and examining their feared outcomes. Let's talk about how exposures work to change behaviors using the example of speaking to a teacher. This makes the child feel scared, and they may worry that they'll stutter or sound silly, so they avoid speaking to the teacher. Avoiding this behavior temporarily relieves their fear, which increases the likelihood of avoiding this behavior in the future. But in the long term, avoiding speaking to teachers won't be a very beneficial skill for the child. So here's what this looks like in an exposure. The child is exposed to speaking to the teacher, and they still feel scared and worried that they will stutter or sound silly, but instead of avoiding, they stay with the experience. And this way, they learn that they can speak even if they are fearful, and that the fear will decrease naturally. The feelings chart will help the child notice the change in emotional intensity from before they started the exposure to when they completed the exposure. The child will also learn that the outcomes they fear, like stuttering or sounding silly, either doesn't happen at all or isn't as scary as they thought it would be. Exposures will occur inside and outside of therapy sessions. In-session exposures will be guided by situations the child identified as difficult. They will be role-playing or practicing speaking in these difficult situations with the therapist during sessions. Out-of-session exposures will also be difficult speaking situations. However, these exposures will take place in real-life situations, such as the classroom. Role-playing these situations in therapy is beneficial, but we want to make sure these skills translate into real-life, everyday behaviors, and we don't want the presence of the therapist or the parents to become a safety net for the child. Exposures are a big part of the integrated behavioral approach to treating selective mutism. So let's look at an example of an in-session exposure. Johnny avoids verbally greeting his teachers at school. In session, Johnny rates the intensity of his emotions before starting the roleplay exposure. Johnny said he felt very scared about saying hello to his teacher. The therapist pretends to be his teacher so that he can practice saying hello. It may take some time, but as soon as Johnny says hello, the therapist reinforces him with a big smile and a high five. Then Johnny rates his feelings again. He still feels a little scared, but not as much as he was before the exposure. Johnny and the therapist talk about the change in his fear and how bad it was to say hello. Johnny said even though he was scared, he was still able to say hello and that it wasn't as scary as he had thought it would be. He also felt really happy to get a high five. This was a great in-session exposure, but remember that out-of-session exposures are very important for generalizing speaking behaviors to real-life situations. Let's hear what Johnny's dad had to say about a recent event.
Things have been going pretty well since we started treatment with Johnny. I know he's been working really hard in session with his therapist to practice things like greeting his teacher in the morning and talking to people that he normally wouldn't talk to, but I've been really curious to see how these out-of-session exposures would go. But just the other day, I was dropping Johnny off at school and he actually said good morning to his teacher, So I rewarded him. I gave him a big hug. I told him I was proud of him, and his teacher gave him a gold star. I'm just really excited and hope we can keep this up.
It's great to hear that Johnny's doing so well with out of session exposures. At the next session, the therapist can talk with Johnny about how his feelings changed before and after verbally greeting his teacher, and if it was as bad as he expected, and why or why not. Towards the end of treatment, your therapist will work with you to transfer control. This may sound daunting, but don't worry, you'll be surprised at how well you know these skills. Parents will work with the therapist to learn how to take charge of treatment strategies, such as rewards charts and using the talking ladder to continue exposures. Your therapist will also help you make a plan for relapse prevention. This will involve noticing if the child begins engaging in avoidance behaviors, working to not fill in for the child, validating the child's efforts, and reward increasingly difficult speaking behaviors with the goal of phasing out rewards as the behaviors become easier. Continue to do exposures after treatment by gradually introducing more difficult situations. An example of gradually increasing the difficulty in exposures might be doing an exposure where your child talks to their teacher before moving on to the more difficult exposure of having your child talk to their principal. Finally, we wanted to tell you about the role of medication for treating selective mutism. Consider adding the medication to psychotherapy treatment if little or no improvement have been made by about the 12th session. Selective mutism can be challenging to treat, and it takes patience and perseverance from everyone involved. It is strongly recommended that medication is used in conjunction with psychotherapy, not as an alternative. If you decide to add a medication to psychotherapy treatment, you should consult with a qualified psychiatrist about what medication to use and at what dosage. Selective serotonin reuptake inhibitors, or SSRIs, are the most promising medication. While no medications are approved by the Federal Drug Administration for treating selective mutism specifically, SSRIs are approved to treat anxiety, and so they may be beneficial for selective mutism. Ask your psychiatrist what medication they recommend, at what dosage, and ask them how it may be helpful for treating selective mutism. I know that we've covered a lot today. You should feel good about everything that you've learned and taking steps to help your child and yourself. This slide gives you a brief overview of selective mutism, how to find a provider, and what the integrated behavioral approach to treating selective mutism looks like. Selective mutism can be scary for children and their parents. You are not alone, and remember, you can do this.